This is Mitchell Warren from AVAC, and delighted to welcome you to this webinar, which falls now just a few days past HIV Vaccine Awareness Day. And hopefully some of you will have been part of a conversation last week where we had an update, as we often do this time of year, around where things are with HIV vaccine research and development. And hopefully you, if you weren't on the call, the recording is online, and you will have heard through both Mary Marovich at the NIH and Mark Hubbard, a leading community advocate around HIV vaccines, the enormous enthusiasm and opportunity right now in HIV science and advocacy. And as we think about all of that, it's certainly exciting. I think many of us would have said, well, it's great when vaccines are in the news and to see all the energy and momentum. And it's not just in HIV. There's good news in other vaccine arenas with a malaria program beginning in 3 countries with a candidate with very modest efficacy. We see Ebola in a horrible outbreak in the DRC, but with a vaccine that is moving forward. We saw recently the first TB vaccine since BCG pass a phase 2B with safety and efficacy, and now conversations about moving that forward. So this is an amazing moment, and yet so much of the headlines around vaccines have a very different picture, which is around actually often misinformation or active disinformation and growing vaccine hesitancy. And we really felt that even though we so often look years into the future with HIV vaccine advocacy, that we needed to look at the here and now to understand how vaccines are understood and playing out. And quite remarkably, just for those in the United States, this morning on National Public Radio, there was a terrific piece looking at a very extensive measles outbreak in the Philippines, not unlike what's happening in this country, and the relationship between that outbreak and the dengue vaccine experience in the Philippines. And it's a terrific piece and really I think highlights why today's call is so very important. I'm delighted to welcome 2 friends and colleagues to the call to provide context about what is currently happening with vaccines and what it might mean for a range of diseases that we know can be prevented with vaccines today, as well as what it means for vaccines of the future, including an HIV vaccine. This call is being recorded, so we have it in a muted mode, but we do want to engage with all of you in a conversation. The run-up show is meant to be Heidi Larson, who is based at the London School of Hygiene and Tropical Medicine and a professor of anthropology there, has also for a number of years created and led the Vaccine Confidence Project. And I'm delighted that Heidi's here. She also comes from a background in HIV advocacy and a broader range of vaccine and HIV communications. So a perfect person to connect the dots there. And I'm also delighted to welcome Laura Lopez Gonzalez, who's the Deputy Editor at Bhekisisa, the Health Journalism Center in South Africa, connected to the Mail and Guardian, both a leading newspaper in South Africa, but also Bhekisisa has become a leading centerpiece for thinking about how we communicate a whole range of health issues. And I'm delighted to welcome them both here. The plan right now is for me to turn it over to Heidi to provide an overview, and then we'll turn to Laura. But let me just first check. Heidi, are you on?
Yes.
*7 to unmute.
I'm here.
You are? Oh, beautiful. Perfect timing, Heidi. Thank you so much.
Okay.
Delighted you were here, and I'm delighted to turn it over to you. I don't know how much of that you caught, but it is so great having spent many years talking to you about both HIV and what is happening and needs to happen in HIV, and really excited to connect it to the work you've done in pioneering the Vaccine Confidence Project. So with that, let me turn it over to you.
Great. Sorry to, just in terms of the slides,
We will advance them for you. Fear not.
Okay, great. Because I can't see them, but that's okay. I have great faith that you'll do it at a pace that makes sense. Hi, thanks to everyone for joining. I'm going to give you a quick run-through of really an issue that's been long brewing. We set up the Vaccine Confidence Project 10 years ago, and I had already been working on this in the context of my role in UNICEF and then independently as a researcher. So I would say close to 20 years of working on this brewing topic, but it seems to have had a perfect storm of erupting, partly fueled by all the other distrust and other issues going on in the world. This is
and Heidi, I hate to interrupt you, before you continue on, it's a little faint. If you can get a little closer to the microphone, that would be awesome.
Okay, is that better?
That is better.
Okay, great. So for the first slide, after the title slide, as I mentioned, this has been a brewing problem, but it's become very global. And one of the concerns about it is that it's all connected, and that connectedness can be a very powerful and positive thing. It's the basis of movements, but sometimes you get movements that are more focused on resistance than positive social change. So, and some of that has elements of social change and in a positive way, but it's expressing itself in ways that are uncomfortable for the public health community at this point. It's become so uncomfortable for the public health community, next slide, that not only because it's the questioning and the anxieties and the different issues around vaccine hesitancy and confidence are largely living in social media and other formats that are outside the usual spaces where public health officials communicate, where scientists communicate, and the disconnect between where the public is and where the scientists and public health officials are living online, as it were, is growing more and more, the gap between. And so in a sense, it's part of a digital technology revolution which has exacerbated polarized societies and created different spheres of interaction, and vaccines have become one of the topics of debate. And what's fascinating about vaccines, and that we've learned through our work on it, I mean, the fact that it touches every single individual on the planet, it's one thing that people in every country have some familiarity with. It's different than, and it touches a range of different, both infectious and chronic disease conditions. I mean, particularly like HPV and hepatitis B. I mean, they're infectious agents that create a chronic cancers, like cervical, liver, anal, the whole group cluster of cancers. So it's an intervention, but it touches a number of different disease conditions. This is why WHO has named it one of the top 10, vaccine hesitancy, as one of the top 10 global health threats. I pulled this slide from Newsweek because it is part of our problem. Instead of saying vaccine hesitancy is listed by WHO as one of the top 10 global health threats, which is what WHO said, it calls it the anti-vax movement. And this is one of the things that has exacerbated the problem, is the framing of this in the public space of being anti-vax, anti-vax. That's not what WHO named as a global health threat. They named the issue of vaccine hesitancy, which is everything from kind of anxiety, questioning, doubting, up to the extreme of a very narrow but loud anti-vaccine group. And the problem with this is it contributes to the polarization of you're in or you're out, you're pro or you're anti. And that's not the state of the world today. And we've developed our Vaccine Confidence Index, and we do extensive research here to unpack that kind of continuum of very pro social norm, people who take their vaccines just because they know they should or it's good, and they understand that it's important for whatever stage of life you're in, to those who are extreme anti. But in the middle, and I would say 80% of the public who have somehow considering vaccination for their children or for themselves, are on that spectrum of hesitancy, that maybe they take some without thinking about it, but others they're questioning, or they have doubts, or it's new, or they've read something on the internet, or somebody's told them something, and they need they're looking for someone to help them understand, should I worry about this or shouldn't I? And they're having a hard time finding that. They feel like they go to the health officials and they just say, take it, it's good for you, and they're not really getting some of their concerns answered, so they go online and find a lot of other, some good, some not so good, some extremist kind of rhetoric. So part of the problem is exactly what this slide is doing, is already taking one thing and renaming it to be more extreme. This is part of our overall political environment, the populist environment, the one people versus the polarization like we see in many communities. The next slide is a demonstration from Italy. Italy is one of the countries where the politicians, and particularly the kind of far right, have taken the question of whether there's a vaccine mandate or not, and divided the public around it for political reasons. And it's caused quite a dramatic drop in vaccine coverage. They had extremely bad measles, to the point that actually, interestingly, it's had to, the outbreak of disease has started to push some rethinking and brought some of the more pro people out of the closet, as it were, to say, wait a minute, when it starts leading to measles and disease, I'm not going to put up with the other voices. And that's one of the reasons this whole issue has escalated so much, is because of the current global measles epidemic, which has been quite, not only created a lot of disease, but also quite a few fatalities around the world. As Mitch mentioned, I mean, one of the recent cases, the Philippines is one of the recent explosions of disease. And when it gets to disease, people say, wait a minute, is my questioning, is my doubting, it puts things in tangible, real life. And also, it brings out of the closet, as it were, maybe that's not the right way to put it, but there are a lot of people who just take the vaccines because they think they should, and they've been, as some of them have said, we've been putting up with the alternative voices, the negative ones, because we don't want to deal with it. But when it comes to it affecting disease and seeing public health consequences, we're not going to put up with this anymore. And then the emotions rise, and then the polarization starts. In the case of the Philippines, just picking up from before, the cases there were due to a total breakdown in public trust and polarization in society around the dengue vaccine, a new dengue vaccine, which I won't spend too much time talking about because it was just mentioned that there was a risk reported after it had been rolled out, and it became highly politicized with the current government and various figures using the opportunity to really undermine the previous government. It became quite vicious, but it created this breakdown in public trust in the health officials, not only with the dengue vaccine, but measles vaccination, but also even things like deworming medicine in the schools. They didn't want to take it because it came from the health officials. So these issues have knock-on consequences for other health conditions and other interventions that aren't even vaccines because of that breakdown in trust. The next slide is to recognize that some of these strong sentiments are not brand new. I'm sitting in the United Kingdom here, well, the not so United Kingdom, but in England here, which was the home to the very first of the anti-vaccine demonstrations, but they weren't really anti-vaccine in the beginning. They were anti-compulsory vaccine, and it wasn't the smallpox vaccine itself, but it was the day that it was announced that there was a mandate. So issues of liberty and freedom of choice and freedom of speech are fundamental to some of these issues, and that's what some of the politicization is around, is not so much the safety of the vaccine itself, but can we have a mandate or not. So then you get these extreme emotions, like you can see the vaccination monster and babies being thrown into the jaws of this monster. That level of emotion is not new. The next slide is another thing that, if you read the newspapers these days, you'd think that fake news was invented by Trump. In fact, it goes way back. It's just the mediums were different. It wasn't the Twitter, it was newspaper, it was on the radio, it was over the telegraph. But yellow journalism and the fake news of the 19th century, I mean, this is an image from 1894. This is an old phenomena in a new medium. And I think that, we're currently, one of the things I've been having to spend some time with in the past months, and it's been increasing in taking time, is with Silicon Valley, with Facebook, and with other social media platforms, because, and we convened a very valuable roundtable at the Center for Strategic and International Studies last week, bringing together a number of researchers, CDC, international partners, because there is a call to Silicon Valley and these technology platforms to clean up the content. Well, is that really their job? And frankly, it's not. They have roles that they can certainly play in mitigating the rapid spread of all this, but in fact, that's the technology behind. Those are the algorithms. But we as a public health community need to get engaged with helping with getting the right content, and it changes the definition of a technology company to becoming a media company if it starts to edit content. So it's a totally different thing and has all kinds of implications, and it should involve a collaborative thing. So the whole issue of fake news is old. It has a new medium. But the other part of it is this whole issue now of controlling the scope and nature of what's on these new digital platforms, on social media, on online news. The UN Office for Human Rights has gotten very concerned about some of the restrictions being put on some of these technology companies and social media, saying that you cannot make any and they convened an extraordinary committee and issued a report that made points such as you cannot put restrictions on social media or technology companies that are not across the board on every medium and every walk of life. You can't isolate a medium. This is about principles of free speech and free rights and responsibilities. And secondly, they raised big concerns that in this era where there is some very incorrect information, very damaging in some cases, and misleading for some people trying to make health decisions, while there is a legitimate reason in that context to try to change and control and manage the information, that allowing that has implications for authoritarian governments and others to abuse that privilege of restricting, and they're extremely concerned about that. So we're in a very interesting times, to say the least, and one of the things that I didn't expect to be spending this much time working on vaccines only. As Mitch said, I have a long background more in HIV and AIDS and sexual health, and I thought to work on this while it was an issue and go back to that, and I've started to through HPV and others, and anticipating and preparing for HIV vaccines, inshallah, that we work on vaccines. But it's the work that we've been doing on vaccines has opened a window to some important principles that are going to be relevant across the board in other health interventions. The next slide is, again, just bringing the point that this issue is not new, but the mediums, the dynamics are changing. This is, an older book, again, from the 1800s, and a billboard in Berkeley, actually, was where I saw it. And what's interesting and very sophisticated from the what is being termed the anti-vax side, they're raising doubt. They're not saying anything that is illegal. They provoke questions. They provoke people to say, wait a minute, I never thought of it that way. People who may not have questioned. So they are out there on billboards, in social media, in different places, provoking questions, saying you have a choice. You have a right to question, which is all correct. Many of the things that are being said that actually is creating this more litigious environment is legally and in a democratic society absolutely correct, but it's misleading in some ways that it may or may not intend to. The use of billboards has fascinated me because it's kind of old-fashioned, and I thought, why are the kind of provocateurs of the vaccine enterprise turning to using a lot of billboards, not instead of social media, but in addition to it? And actually, I thought it's really a very powerful medium, because in social media, you stay in your own echo chamber most of the time, and you reinforce each other's beliefs. But you throw a billboard over the highway, particularly on a highway going from Berkeley to Silicon Valley, where you sit in your car for a very long time, as in many cities. You capture an audience, many of which have not seen that in their social media echo chamber. So it's actually, ironically, kind of reaching a broader audience, maybe not in scale, but in terms of differing views. Next slide. This could have been a demonstration in South Africa for access to ARTs, but this is against measles. It's what's also another medium. We need to look at the bigger ecosphere of how people are expressing their views, and it's not just on social media. As the UN Office for Human Rights say, we have to look at across the board where these expressions are coming from, and it's in billboards, it is in protests on the streets in a number of different places, and we see protests against and for. There is a phenomenon that the ones against tend to be louder, more aggressive in some cases, even though they're a smaller part of the population, but they're out there. So this is very real. The next one is in the U.S., green our vaccines. We often talk about in the vaccine hesitancy and vaccine confidence space that there are two really driving themes. One is liberty and one is purity. Liberty is my right to choice, my right to access to information, my right to free speech. The other one is purity. Back to nature. There's an incredibly strong back to nature movement that is becoming part of an identity. Paleo diet, gluten-free, home birth, don't use contraceptives anymore, get a rhythm app, measure your temperature, do it the natural way, and a vaccine-free childhood. Now this starts to become part of an identity where some mothers have said, you know, I hadn't really thought about vaccines. I was into all the other bits, but then I realized that, you know, this group I'm in, they're also not taking vaccines, so I figured that's not the right thing to do. And as you saw in the billboard, with the comparison to the apple, there's a new focus not just on vaccines, but on the ingredients in vaccines. And they're kind of overstate the negativity of those, many of those ingredients that they look at as kind of toxic actually are the things that keep the vaccine pure and safe. So there's a lot of misframing of what actually is happening, but this is just to give you the other side, which is the issue of nature and purity and keeping it green. As I mentioned, you know, this is becoming increasingly recognized is this challenge of the viral spread of these sentiments I've been talking about, not just with vaccines, which is what I've been writing more about, but with science more broadly. I'm working on a big initiative with the Wellcome Trust on public trust in science. Vaccines are just one emblematic window on a broader range of issues where the science, trust in science is eroding. The next slide is also to bring you know, a window on the fact that this is by no means a you know, U.S., Europe, Western, or a higher income country phenomena. This is very real in all the poorest as well as the higher income countries. We've seen, for instance, in southern India, a major What's Up in Facebook campaign undermining a measles rubella vaccination effort. I mean, these are not new vaccines that have concerns. I mean, these are some of the oldest vaccines that have saved lots of lives in India. What's going on there? We saw a similar thing happening in Malaysia and over to Indonesia. And what's also interesting is the nature, back to nature part of this, the naturopathy, homeopathy. We see even in the issues going on in southern India, as well as Malaysia and in Indonesia in an even bigger way, they partner with naturopathy, homeopathy. In Indonesia, it's someone who does cupping and you know, suction on the back to pull the blood and the bad things out. So it's proposing, so you get on the one hand people posing questions and doubts about the safety of vaccines, teaming up with people who are saying, and I've got an alternative for you. So people are, it's teaming up. We see it more and more. The next image I mentioned before is about working with these social media platforms. It's not just Facebook. They seem to get more profile, but it's the whole Pinterest, YouTube, Amazon. I mean, if you go to Amazon and just look for a vaccine book, they're trying to change this, but you know, pretty much the top 10 were all anti-vaccine books. How can the algorithms try to change that? Last week, or yeah, it was a week ago, Twitter, all of a sudden, if you clicked vaccine to search in Twitter, it took you straight to HHS. And in the UK, if you did that, it took you straight to NHS UK. That was pretty radical. I mean, it had a bit of a Big Brother thing, but it brought that one to the top. You could go to two items down on your search, and already you would get the other less positive stuff. But the fact that by one switch of the algorithm, all of a sudden everywhere you go straight to the government site, that on the one hand is trying to do a positive move, and others could interpret that in different ways. I'm going to move on to the next metrics and mapping. We can already go to slide 14. So the last slides I've been showing you is just to give a broad look at the context, the environment, and as I mentioned, I set this initiative up about 10 years ago, and the main thing I really thought was needed, and why I have built this team that we have, which is now quite global, is to get some metrics around this, because one of the things I saw in the first 10 years I was trying to get a better handle and understanding on this was that my struggle with getting some of my public health colleagues to pay attention to this, what I saw as a growing issue, was that it was too messy. It was emotional. It wasn't fact. It didn't fit. It was hard to get their hands around. How many? And the question I constantly got, well, how many people is it? What's the percentage? Is it something? It's not something we should worry about. So the first thing I did while at UNICEF was to get one extra question in the annual, what they call joint reporting form, which was reporting on how many kids were immunized and some basic questions about the immunization program. We added one question, and the one that I proposed was, have you had to manage any negative media around vaccines in the past year? This was in 2003. That was 15 years, just over 15 years ago. 25% of the countries said yes. So that already woke up a number of people to the fact that this was real, that was large, and we knew it was more, because Nigeria, for instance, said they had no problem, and that was in the middle of the big polio boycott. So some countries, I'm sure there might have been some who said yes, and no who could have said yes, but anyway, 25%. And I saw the change. I saw people's attention change to it with that number. So one of the main things that we try to do is to characterize and bring some metrics to it. This was a global, we've set up a global media, social, and increasingly social media monitoring system to keep our finger on the pulse in social media on negativity, positivity, and more importantly, to keep an eye out for emerging issues. The reason we want to monitor these trends is to try to capture earlier issues and questions before they erupt into disease, have implications for disease outbreaks. Next slide. The other thing we've developed, because you can get some signals in social media and online news media, but it doesn't have the kind of sampling. You don't always know who's talking where. So we established what we call the Global Vaccine Confidence Index. If you can think of the parallel of the Consumer Confidence Index, which is kind of getting a measure of people's willingness and confidence in the vaccine. And we zoomed into 4 key questions. We ran a lot of questions to try to understand which ones resonated the most and gave us the most insights. 4 statements with a strongly agree to strongly disagree. Vaccines are important, vaccines are safe, vaccines are effective, and vaccines are compatible with my religious beliefs. And then you just need to say strongly agree, tend to agree, tend to disagree, strongly disagree. We've been running this. We have over 300,000 data points on this now, and we've been watching the sentiments change. The next slide. This was a map they used in 2016. we did a 67-country global study, and what we found was that the darkest countries are the ones, the darker the country, the less they believed vaccines were safe. France won the prize. They were absolutely the most skeptical and remain the most skeptical. We've had a number of new waves since then, although they've come up a little bit. 41% means 41% of those sampled said they disagree with the statement vaccines are safe. The average around the world was about 13%. Russia was pretty high. Eastern Europe had quite a few high points, high in terms of disagreement. But we've been monitoring this. We now have the European Union has commissioned us to do this every 2 years. They want to see if the numbers are going up or down. Next slide is a collaboration we have with ECDC, the European Centers for Disease Control, to take that overall sentiment metric, which doesn't give a lot of detail but just gives you a sense of sentiment. The other metric is to dig down a bit deeper and see, well, what's making people, what are people's concerns and questions? And overwhelmingly, again and again, this is similar to other research we've done, vaccine safety is the overall concern. They sometimes call it something else. They might say it's a religious reason, but really, if you keep asking, they'll say, actually, I don't trust the safety. So that's something we need to do a better job of communicating on the safety. The next, we can skip the title slide on vaccine confidence and go straight to the slide 19. So as I said, the EU was quite interested in understanding change over time. If there's one thing that's been very different now than 10, particularly even especially 20 years ago, is the volatility of people's opinions. It's changing all the time. 10, 20 years ago, and certainly before that, people might have their views, but it was more stable. Now, particularly in this Twitter time environment, people change their point of view up and down quite a bit. We even had one woman that we were interviewing in France say, well, yeah, sure you can interview me, but I might change my mind next week. And it kind of captured what we were hearing from a number of people. As you can see, France did a little bit better this year. They were pretty happy to see that they put quite a bit of effort into confidence building after they saw our first study. What they told us was, I thought they might be concerned about being cited as being the most skeptical, but in fact they said, thank you. We knew we had a problem. You helped us understand how big it was relative to others. So that's one thing that a number of countries have told us. In the last couple of years, you can see, although you can go up a little bit, France went up a bit in the perception of importance, not so much in terms of safety and efficacy, or effectiveness, I should say. Poland dropped dramatically, and we knew that was coming because we didn't realize it was going to be that much. We had had a number of calls from Poland about a growing and very politically embedded anti-vaccine movement. And we also knew that it was having an impact beyond Poland in the Polish press. There's a large Polish population in the United Kingdom, and the Polish communities in Scotland, which have been usually some of the better vaccinators in the last couple of years, have started to get much more hesitant and refusing vaccines. So it's not just in the geographic country, it's in the diaspora of language networks. The next slide is, in addition to those core questions, the EU asked us to apply them to additionally MMR vaccine, measles, mumps, rubella vaccine, and flu. So this was just the overall combined EU, but it means that only 52, half of Europe strongly agreed that MMR's vaccine. 43% of the European Union said they were safe, but if you look at anything to the right in shades of blue, those are all people who tend to or strongly disagree. Next slide, please. Oops, it's a double one. Oh, no. Yeah. Can you go to slide 22?
We're there.
Okay. In addition to it, we, Mitch, how much more time? I can speed through.
Actually, I do want to leave time because I know we have some questions. So if we could get to that quickly, that would be great, Heidi.
Okay, let's just just to show you that overall, the good news is that GPs are overall confident. But next slide. When you ask about their recommending behavior to others, it starts to change. Red is unlikely to recommend the vaccine. Now, what's even more concerning is when we added the question recommending a flu vaccine to a pregnant woman as one of the key risk groups, you can see the red. So there's a problem. I mean, there's a challenge. If the GPs, who are supposed to be the point of reference for confidence and modeling, 72% of them in Czechoslovakia, or Czech Republic, I should say, and 69% in Slovakia are saying, I'm not going to recommend that vaccine. That helps us understand and why the EU wanted this is to understand, okay, we'll focus our efforts in these areas. Next slide. The Philippines. So we took this in light of the whole dengue saga that I had mentioned earlier and that Mitch mentioned in the beginning. We had in the 67 country study, Philippines was in that study, so we had a baseline in 2016, and after the news of the small risk with the Bhekisisa vaccine that required some relabeling of the vaccines, we saw the explosion of the political drama that in 2018 we reran the index, and the reason that we reran it was because of, on some of the next slide, 25, you can see the extent of the anger and the emotiveness that was in the press. Over to slide 26. When we reran the Vaccine Confidence Index 2015, the 2016 study I referred to, actually the data was collected in 2015, but it was reported in 2016. So that's the same 2015, and in 2018, after the whole launch and then the risk reported with the dengue vaccine, you can see the change in the amount of red. The red left-hand side shows you that there was a pretty dramatic increase in disagreeing with the safety, the effectiveness, and even there's a change in compatibility with my religious beliefs. I was fascinated by that, but I think it's because people lost it was about trust and it was about faith, and they lost their faith in the institution, and it was not compatible. The behavior of the health institutions were not compatible with their religious beliefs of what's right. So this was, and what's interesting about this study, we got the data out pretty quickly afterwards, and we just reran it to see if there was a change. This report, I was told by a number of people in the government and some NGOs, totally helped trigger some positive action to start rebuilding trust. Because they had some numbers to work against. So once they knew it dropped 30 points in importance or safety, that we want to get back there. So there's been quite an effort, aside from the measles outbreaks, which were another driving factor, and we're hoping that the data I'm waiting for is positive, or at least shows a starting to slowly build confidence because it keeps people motivated. We can skip the next title slide and jump to.
And actually, Heidi, before we jump, this is so great, and a question came in, and I wanted just to jump in now and actually maybe see if Laura Lopez from Bhekisisa might want to also answer it along with you in the interest of time, because I think it's incredibly relevant as you showed that example. But one of our leading advocacy partners in Malawi actually asked, what's the situation like in Africa around vaccine hesitancy, and how might it be different? And I wonder, maybe just to jump in, if Laura, you wanted to give a quick sense of that sitting in your seat as a deputy editor of a leading journalism center in South Africa, and then we can certainly jump back to that, because I think the HPV stuff is obviously incredibly relevant, also thinking about HIV. So I don't know, Laura, if you want to just quickly jump in, and then Heidi?
Sure. Yeah, I think Heidi's points are all really on point for even what we see here in South Africa and more in the global South. And I think that there's three big things, and it's about trust, emotion, and then really bridging that gap. So vaccine hesitancy, what we are finding is that because these conversations are happening in sort of the dark corners of the internet, like the sort of Facebook groups and the WhatsApps and YouTube, we pick up some of the same vaccine myths that you get in India, for example. So if you look at the HPV vaccine rollout in particular, the same questions and myths that happened in Tanzania and also in South Africa happened in India, and I think there was one other country, I think, in Eastern Europe. So, questions about whether it would affect girls' fertility, et cetera. And I think that also kind of talks to a little bit about kind of where our messaging is as public health advocates, and maybe where the other side, sort of the anti-vax kind of, for lack of a better kind of catch-all phrase for what happens on social media is. So yeah, I'd love to talk about some of that, the things that we pick up in terms of what sparks emotion in people and how that's been picked up in some of the science. But I know I want to give Heidi a chance to respond to this as well.
Yes, thank you. In Africa, right now we have a very large area of work right now is around the Ebola vaccine trials and the emergency use of vaccines. And that's, those are deep histories of distrust, both in West Africa. It was more historic, starting to recover, but we are in live conflict and insecurity in North Kivu. It's the biggest reason we haven't eradicated polio in the world, and why polio is sitting in, the Pakistan-Afghanistan border, and why we're having such a challenge there. The contextual issues that affect public trust in general affect vaccines. So sometimes the actual confidence index issues and the emotional issues are not specific to the vaccine, but the vaccine becomes caught in this overall situation of insecurity, distrust, fear. So in Africa, that's in the context of Ebola. For other vaccines, we've had different issues in different settings, sometimes suspicions around the polio vaccine, but also tetanus and HPV. Kenya dug up 20-year-old rumors about the tetanus vaccine sterilization and the Catholic bishops. What's interesting in the Kenya situation, these Catholic bishops, their first resistance was only because they are typically always involved in vaccination campaigns, and for some reason, the tetanus vaccine campaign, they weren't engaged. They weren't contacted by the government, and they said they started to get suspicious about something being different. They went online. They started to look for all kinds of things about the tetanus vaccine, found old rumors. it became a big saga. So to me, the message is less about worries about safety, but the importance of engaging key people in the public.
That's so great. And I think it's so relevant both to the rollout of vaccines, and I think we see some of those same issues actually obviously in thinking about recruitment. Actually, someone had posted in the chat feature early on that that she was saying as you were talking at the very outset, Heidi, someone chatted in that this distrust of health officials in vaccine programs makes me think about distrust within certain communities around even enrolling in trials. So I think that's, again, one of these connections. And in fact, and again, I'm so sorry to break the flow, but actually I see a hand is up actually from Mark Hubbard. I don't know, Mark, if you have a question, because my guess is it may be quite relevant to what folks just said. Oh, Mark just said no, he doesn't have a hand up. Okay. Maybe again, and again, I think the work around HPV in Japan is particularly exciting. But I do want to just pause because I know we lose some people at the top of the hour. But I wonder if anyone wants to jump in. You can hit *7 to ask a quick question if you have one. Now that we have a bit of a break, I'll pause for just a second. Okay. So maybe, Heidi, and I know we lose some people in just a few minutes at the top of the hour, but I wonder if, because I'd love to give both you and Laura a few minutes just to kind of say, like, what can we best do around managing all of this as we look into the future, and both in terms of vaccine programs and in terms of vaccine research and development as well. And I wonder if maybe if you both want to just take a couple of minutes to kind of give a sense of, so what should we be doing in this current context? And hopefully, Heidi, not to force it too much, but to kind of think about some of the things you haven't been able to get to in the slides to help give people a sense of, given all of your experience and your work in HIV, what do we do next? And then also, Laura, what should we be thinking about in the way in which we engage with media and with communities?
Mitch, do you want to just zoom to the last slide?
Sure.
That's our web page, so people know where they can find out more.
It's there.
One thing is on the map every day, or the news is always changing, and we're trying to capture emerging issues as they happen. We have a confidence commentary. It's me or somebody else, or highlights, and new literature as it's emerging. And we have some resources there in the different tabs on the top. But I think two things are really burning importance. One is we need to help bridge this huge gap between the ways that public health officials typically communicate and where the public is living online. It's a huge valley, and any efforts we can make to get some of the accurate information and engagement, not just as information, but engage with people who have questions while they're asking questions, because what I see is this pattern of when their questions aren't answered, we're losing them. They feel like they're either being get suspicious, like the Catholic bishops, or they feel like something's being hidden, or they just get discouraged. So any level of engagement, and that's actually from online into the clinic itself. I think we need places, I think with more and more vaccines, and also with governments pressed with budgets and times of health professionals, there's just not enough time to answer the growing amount of questions, and there's a time pressure there that is we need to find other opportunities for discussion and engagement so people feel like they can have a conversation about this without being judged.
Yeah,
that's great, Heidi. Laura, go ahead.
Yeah, no, I think that it's all about the gap, and I think, we in an age where like the anti-vax like community is using like bots at this point, we're just like so far behind in terms of where we are meeting people. And I think that we're not only, it's not physically, it's not just virtually, but it's also in our thinking. So for instance, like I can tell you why Newsweek said anti-vax versus vaccine hesitancy, and it's because anti-vax is half the length of vaccine hesitancy, right, in terms of characters,
yes.
right? And then also, vaccine hesitancy, though, on point with like what it's trying to communicate is like not as sexy as anti-vax, you know, right? So an anti-vax has become this kind of, if I say it to somebody, they sort of immediately know what I'm talking about. So how can we, as public health people, sort of rejig how we talk or how we frame our ideas in a way that's more palatable for the general public? And we see this in HIV all the time. So we're just about to do a big policy dialogue about age-disparate relationships, which are very risky in South Africa. Most people would refer to those commonly as blessers, but it's very uncomfortable for the public health community to call it that. So somebody proposed a hashtag, the hashtag for the conversation was going to be age-disparate sex. And I'm like, nobody talks like that, right? So how do we kind of tweak our messaging in that kind of way and work in that way? I think also, you know, this dependence maybe, or this looking to journalism solely as a way to kind of communicate is a little, it's interesting in an evolving kind of time. So I know that there's like 2 or 3 doctors in South Africa that are on Twitter that will go after the anti-vax kind of sentiment like every single time it happens. And I mean, I'm sure they are exhausted by having to deal with all the trolls, but we're kind of now in an age where medical professionals can kind of talk directly to the public and start meeting people, those false ideas where they live. It's not easy, and it's scary, I think, for a lot of people, but that's something I think we should look at. Because I think, and I think that lastly, I think that the way we talk about this is something that we're going to have to rethink and completely kind of go outside the box in some ways, because there's really interesting research in Science last year, and it looked at why false information went farther than truth. And it said false information inspired fear, disgust, and surprise in replies. True stories inspired anticipation, sadness, joy, and trust. So we know, for instance,
which author was this one? I think I read it, but there were a few related articles. Do you happen to remember? Okay.
I can't remember. I could also send you the link. I think I actually saved it somewhere. But it was profiled. We carried an opinion piece by a doctor, and he cited it. And he was he had the same sort of sentiments, right? So like, we're not where this conversation is happening. And I don't think in terms of what's happening in WhatsApp that we can rely in the future on regulators. So we know, for instance, that our Facebook posts on harm reduction, the decriminalization of sex work, never get approved by Facebook, so we basically can't post to it. So we know that the regulation already is a little flawed, right? So, but we know that when we post stories about grave injustices, we get what we call rage clicks, because we're inspiring fear, disgust, and surprise. We know when we do stories that inspire anticipation, sadness, joy, and trust, and maybe a little hope, that we can really pull readers in, and that's content that they come back to time and time again. So I think maybe sometimes the way we talk about things could be shifted.
You know, both of you just highlighted so many important pieces there. And again, I know it'll just past the hour and people are moving off, but I wonder if I could ask you both to also comment, because it came in on the chat feature as well. And it's something we grapple with as AVAC. You know, we are both HIV advocates, we are HIV vaccine advocates, we are vaccine advocates. And those are 3 kind of distinct adjectives about advocacy. And someone actually asked a question in the chat box. What is the role or what is the work that HIV advocates and advocates on the R&D side should be doing in the context of vaccine hesitancy and confidence? And I wonder if you could both just give a quick comment on what you think, HIV advocates and R&D advocates should be thinking about and supporting in the context of all that you both have said.
I think every effort helps. So, I mean, in HIV now, I mean, with the trials in South Africa, I think I feel that we need to get there earlier and earlier from the trial space to the more we can use opportunities to get people involved and aware before it's there in the clinic as a recommended or required vaccine, the better, for one thing. And I think we see very clear evidence of confidence in health services and health as being the higher the confidence in the health services, the lower the rates of vaccine hesitancy. So any opportunity we have to make health services friendlier, open, more welcoming, it's going to help across the board. We can see the reverse of that in the Philippines. You can switch that around, and by creating a more positive, supportive, open environment, it's going to have a knock-on effect.
Beautiful. That's so great, Heidi. Laura?
Yeah, and I think that's great. I think looking at, like, for instance, what we kind of see in South Africa, I think it's sometimes that the pathway to a more trusted health system is hindered a little bit by some structural things we're not going to get rid of anytime soon, right? So our nurses have like 5 minutes per person, and I think there's a lot of barriers there. But I think like engaging with the media, I think kind of more regularly and way before you, for instance, have like a trial result or something like that. And I think kind of really thinking about how you can keep refining and making that message sort of new and how you can kind of keep coming up with angles. So the other thing that science paper, which I shared a link to the opinion piece that has the link to that science commentary in there. But the reason that false information was also going deeper, faster, and farther was because it was seen as new. So I think working on the narratives that we tell and how often we communicate and really and where we communicate is probably a start to that too.
Great. Laura and Heidi, this is so fantastic, and it's never about any one issue. It's not vaccine confidence in the sense of measles or dengue or confidence in public health or confidence in research. It's about, I think what you said, Heidi, it's about confidence in and trust in the systems. And there isn't a vaccine for many of the structural things you described, Laura. I wish there were. It would make all of our work easier. But you both have done a remarkable job. I know other questions have come in. I'm delighted that, Heidi, we have your slide up and that we can drive more people to this, no matter what we call it, whether it's about hesitancy or confidence or anti-vaxxers. The ability to connect the dots across these issues is essential, and what you have both done so beautifully here. I want to thank everybody for being part of this, and really look forward to keeping the conversation going. And we really are working towards a period of advocacy that is about research and development and delivery, and confidence and trust and integrity in the scientific process and in public health. And thank you both for putting that in context, not just because it's HIV Vaccine Awareness Day or week, but it's because the work that we all need to be doing. And I know there'll be lots of follow-up, and I know, Laura, you just posted in the chat feature, we'll send it around as well to people on the call, the article about issues of emotion and false information. And I know there are going to be lots more things to talk about. So I just want to thank everybody very, very much.
Thanks.
Thank you.
Cheers all. Have great days.
You too.
Bye.
Cheers. Thanks again, Heidi and Laura.